So let me talk about a revision of the order that we're issuing today. And I want to go back a little bit in time. We're calling this an urgent health advisory. Ohioans protecting Ohioans. Urgent health advisory. Ohioans protecting Ohioans. Since the original stay-at-home order, a lot has happened. Our orders have evolved, and the circumstances have evolved in Ohio as well. So it's now time for our orders to reflect the reality of where we are today. These really are the essential facts. One, Ohioans, through social distancing, have avoided overwhelming our hospitals, and we have flattened the curve, and that has been great work by all of you. Number two, a new number for some of us learning it, but we've been watching it for a while in Ohio. The R0 number is now 1-to-1. It had been 1-to-2, which simply meant that one person was, on an average, was infecting two people. Now those numbers are down 1-to-1. Number three, a lot of our fellow Ohioans have worked very hard to come up with the best practices for business as they reopen. Those best practices that have been worked out by business, by professionals, by people in the health community are now orders. We have put in place a specific framework for how business operates that was not in place when we issued our original stay-at-home orders. These new orders protect employees and customers alike. 4, our original stay-at-home order had exceptions, including such things as going to the grocery store, to the pharmacy, checking on elderly relatives, attending funerals, weddings, church services, walking in a park, to name a few. Each order, number 5, each order that has reopened a business sector has created additional exceptions to the original order, which has in turn created additional opportunities for people to leave home. 6, in fact, on April 30th, we changed the name of the order from stay-at-home order to a safe-at-home order. And so we are now moving from orders to strong recommendations. This is a new phase in our battle against the virus, and it really is even more incumbent as we open up Ohio economically. It's really more important and incumbent upon each of us to protect each other. Our new urgent health advisory is titled Ohioans Protecting Ohioans. It incorporates 6 feet of social distancing, a limit of 10 people for mass gatherings, frequent hand washing, other sanitation efforts, etc. It incorporates all the business orders about social distancing and sanitation, including employees wearing masks, as well as efforts to protect employees and other efforts to protect the public. All of those are incorporated in this new order. Let me talk about our most vulnerable Ohioans. Our new urgent health advisory considers our most vulnerable Ohioans as those who can suffer the worst impact from the virus. They include those who are 65 years of age or older. They include people of all ages with underlying medical conditions, including chronic lung disease or moderate to severe asthma, serious heart conditions, compromised immune systems, obesity, diabetes, chronic kidney disease, and liver disease. Our urgent health advisory strongly recommends that these Ohioans stay at home as much as possible. They should avoid places where they're likely to encounter a lot of people. When they go out in public, they should wear a mask unless not otherwise indicated, and should practice good hand washing hygiene, and should, of course, practice the social distancing. They should limit trips out. They should be exceedingly careful. That's for our most vulnerable Ohioans. And again, it is a significant number of people, because it's not only those over 65, but it's also those with the medical conditions that we just listed. And again, these are not new. You've heard Dr. Acton talk about these medical conditions many, many, many times. Let me talk about the rest of Ohioans. For everyone else living in Ohio, we today call upon your sense of personal responsibility and accountability to others. Those Ohioans not considered at high risk certainly can carry the virus. They can spread the disease even when they're showing no symptoms and unaware they are carrying that virus. Even those Ohioans who are not the most vulnerable for death from COVID-19 are certainly vulnerable, we have learned, and we have seen. They're vulnerable to developing severe complications, such as a stroke, and experiencing long, extended stays in the hospital, as we heard from the two individuals who called in the last few days. Our health advisory recommends, but does not require, it recommends, but does not require, that those Ohioans, the rest of the Ohioans, stay at their place of residence when possible, with the intent of lowering the rate of the spread of COVID-19. Young, healthy Ohioans should take protective action, and any Ohioan should take protective action, because they could unknowingly pass this virus on to one of their fellow citizens. All individuals in Ohio are advised to take precautions to limit the spread of this disease. And again, this could occur unknowingly, as we know that there are many people who carry the virus, but who do not show symptoms and certainly do not know themselves that they have it.